Community After Quarantine, hosted by Texas Oncology and the Texas Oncology Foundation. Today, we're going to discuss what cancer may look like in the wake of COVID-19. What is on the minds of everyone right now, what we're thinking about, how we're enduring, how we're maintaining, how we're moving forward. How do we try to move forward with cancer and COVID-19, two things that can be very heavy and very daunting. And we've got a great panel lined up today to help us do that. Housekeeping for Zoom. Only you can see and hear us. We can't see or hear any of you unless, of course, you are utilizing the chat. And please utilize the chat. We want to hear from you. We want to hear something resonated from you. Say yes, give us a reaction, give us a thumbs up, say yes, I agree with that. If there's a question that you have, put it in the chat. It may be helpful for also someone else who's on. And just let us know if there are any additional questions. When you all registered, there was a question feature. So we do have some questions there. And so we'll answer as many of those questions as we can. If there are any technical difficulties, Kelly Condon, who is the program coordinator for the Texas Oncology Foundation. Hi, Kelly, you can't see her, but she works really busy behind the scenes. And if you've ever been to our Survive and Thrive events, you've seen Kelly running around. So hello, Kelly. But just reach out, privately message her, and she will help you shoot through things. A little bit about me. I'm a 19-year, as of April, I'm a 19-year cervical cancer survivor. When I was first diagnosed with cancer, I didn't see my life as it is now. And, you know, I just make my survivorship count every single day. I'm still here. And so I learned how to live life and, you know, not to be too cliche, but to smell my roses. But that also means helping other patients and caregivers navigate through the cancer journey. And so I'm honored to do that in the work that I do here through my own nonprofit Survivor, but also many organizations that I work with. And as most of you know, one of my favorite events is the Survive and Thrive Symposiums, because that to me is what surviving and thriving through a cancer diagnosis is all about. A little bit about the foundation. The Texas Oncology Foundation is dedicated to providing support to cancer patients in communities where they live, work, and receive treatment. I think that's so incredibly important, and they do it so well. Through Survive and Thrive programming, the foundation is able to provide educational events and resources to both help build community connections and support all. I love that the most, because it's not just for the patient that's receiving the treatment, it's also for their caregivers. And that means whether it's a family member, a best friend, a coworker who's there for that patient. And I think that's incredibly important to celebrate the full community in cancer care. All funds raised stay in the Texas Oncology communities to provide financial and transportation assistance to those receiving treatment. Super important. With that said, I'd like to introduce our wonderful panel that's directly in the Texas Oncology community. And so we will have them just really introduce themselves. I'm going to start with Dr. Willifong, and then we'll go to Dr. Pat, and then Stephanie Broussard, who we're just elated to have you join us today. Thank you. So Dr. Willifong.
Hi, thanks for being here. I'm glad that I was able to join too. I'm Leyland Wolfong. I'm a medical oncologist. I work in the Dallas area at Presbyterian Hospital. I also am the Vice President for Value-Based Care and Quality Programs for Texas Oncology, and I am chair of the COVID Task Force for Texas Oncology. So all of the screening and things like that that we're doing in our clinics comes through the team that works on this for us.
Awesome. Thank you so much.
And I'm Dr. Deborah Pat. I'm a medical oncologist in Austin. It's been my privilege to be in the Texas Oncology family now for over 13 years. Like Leyland, I also have a leadership role within the organization as I'm an executive vice president of Texas Oncology, helping with policy and strategic initiatives. So really I work for Texas Oncology and all the things that I am. Stephanie's my boss some days, Leyland's my boss some days. But we have a really important, I think, talented team that's, laser focused on providing the highest quality of cancer care in our community. So it's been really heartwarming to see how that has grown under Leyland's leadership during the COVID-19 pandemic and with growth of our organization with folks like Stephanie and others.
Wonderful, thank you.
Well, hello, I'm Stephanie Broussard, and I am the Director of Palliative Care and Social Work at Texas Oncology. And I have the pleasure of helping to support our organization as we look at the psychosocial and emotional needs of our patients, but also the initiatives about making sure that we care for our patients at every stage of their cancer process. And so it is a joy for me to be a member of this organization under the great leadership of Dr. Wolfong and Dr. Pat and many others. So I'm happy to be here.
Thank you. Thank you all so much. So I have just a little icebreaker question to start it off. And so tell me, how are you making it through this time of staying at home and newly things being lifted a little bit? So how have you maintained and that your patients may not see so often? For me, a small thing like having fresh flowers in my home has really brought a little bit more joy, especially when it's kind of gray outside. And so I'd love to hear from each of you how you're maintaining during quarantine.
Do you want the honest answer or the answer that's publicly available?
Always be honest.
No, I think it is challenging, right? I mean, I have 2 teenage daughters at home and a wife who normally has the house to herself during the day. And so we're all on top of each other a lot more than we used to be. And in fact, my daughter the other day said, she'd kill me for saying this, so if you know my daughter, don't say anything to her. She said, "Dad, I love you, but I'm so tired of seeing your face. I mean, I love you, but I just don't want to see your face anymore." So funny. So I think at our house, we've gotten to where we make sure that we respect each other's time. We have our family meals, which has been fantastic to actually concentrate and have family meals together, which got lost a lot in the busy hubbub of school and work and other priorities and things. So that's been fantastic. And then we all have our own areas where we retreat to. What I've done is I have puzzles. I love putting together puzzles. And so on our formal dining room, that's my puzzle area. And so that's my area where I go work on my puzzles, and my family comes in or leaves, but they know it's puzzle time when they're in there. So that's been really great.
So I would say that coronavirus has given us many different challenges professionally and emotionally. And I think most of us have a spectrum of tools that we use to manage that increase in stress in our lives. Among those, I'm going to talk about healthy aspects of that spectrum for me, though they've not all been entirely healthy. I think that, like Leyland, I have young kids at home. So I have a 17, 14, and 11-year-old. And my 14-year-old has engaged me in how to use apps to improve the way you manage stress. So she's had me download the Calm app for meditation. I've downloaded the Pilates Anytime app for my reformer, and Gaia.com, which is on-demand yoga. And so those are, I will say, not all of my coping behaviors have been among the healthiest, but those are some of the healthy stress management tools that I feel like have been important behavioral ways to manage the crisis.
That's wonderful. And I'm so glad you mentioned the Calm app. And if people aren't familiar with it, it's a wonderful mindful meditation app. And right now it's actually free for anyone who may have lost income or anything like that. And I do think they also do something for cancer patients that may be 30 days. So definitely check out the Calm app. And now, Stephanie.
So for me, I have 2 little ones as well. I have a 2-year-old and an 8-year-old. And so just finding the balance, trying to really recenter myself. I echo Dr. Pat's sentiments where it's brought some challenges, but also some unique opportunities. The challenge is that, we don't only have to work, but we also have to be a teacher. And so for some of us, that's different, managing that workload. But I've really been grateful for the time to reset. I think, like Dr. Wilfong said, we have so much, we're so busy. You know, we go from work, we go to activities, to school, like we're just, our time before was so consumed. And so it's really been an opportunity for me to kind of reset, reprioritize, and just refocus on things. And I felt a sense of, even with the stress and strain, a sense of calm kind of in this season of that it's challenging, it's stressful, it's hard, but also the refining, I think I can appreciate in resetting. So I like to meditate. I believe in meditation. I also believe in activities. We have these boys, so we have to run all that energy out of them or they tear our house up. So we do a lot of physical activities in the backyard. And we're riding bikes, those kind of things. So just trying to stay busy as much as possible with them to keep their minds active so we don't get idle, but also celebrating the downtime too.
Yeah, wonderful, wonderful. So thank you all for sharing. Let's just jump right in here because we've got a lot to get in a limited amount of time, but we'll make it happen. So we know there's a lot circulating about this pandemic, right? And it's hard to tell what's accurate. What should patients and caregivers look for when they're looking for the most accurate and the most up-to-date information, Dr. Wilfong?
Great question. There's a lot out there, a lot of fake news on social media in particular. So just be very careful where you're getting information from. The Texas Oncology website, our team does a very good job keeping that updated for you. And so that's a great place to get information about COVID. The CDC, the Centers for Disease Control, also has accurate information. The Texas Department of State Health Services is another great place to receive up-to-date information about Texas. I would also go to your local county health department website to get accurate information from them that's scientifically and factually based. And then the American Cancer Society also has good information out there specifically for cancer patients. And so those are reputable sources to get information.
Wonderful. Dr. Pat, as we look at reopening and trying to navigate the new normal, we have patients who have, had to maybe put off screening or treatment, or even just the other things. As cancer patients, we focus so much on the things that we need to do for our cancer treatment, but there's the other things like, eye checks, skin checks, going to the dentist. Where are we with telemedicine expansion, and what do our community need to know about it to move forward during this time?
It's a great question, Tamika. Thank you. So I'll say that we are seeing the state open up around us as the governor and his team has felt it's safe to reopen. Things like childcare centers have reopened, even bars will reopen, some camps will reopen. And so we see the world opening up. And we have to remember cancer is different and cancer patients are different. We as a community have to be a lot more cautious because we see Texas's most vulnerable patient population. And so even though many things around us are opening up and becoming normal, our clinics still have to have altered operations, and our patients still have to have a heightened level of caution because they remain at risk. And the patients that are undergoing treatments that render them more susceptible, or who have cancers that render them more susceptible, because cancer patients have an increased risk of death from coronavirus, still need to exhibit caution until community prevalence is near zero. So telemedicine has been a great way to support our practices, as we're seeing about a third of our patients by telemedicine. We're seeing new patients and established patients by telemedicine. Our pharmacists are using it to support pharmacy. Our social workers are using it to support groups. So it's been a real gift to us in the practice. And we have on the landing page of our website a telemedicine opening page where you can go in and see how to obtain a consultation or visit through telemedicine with instructions as well. But it's been really important to us, and I think will be important probably through August, while there's still, to be determined based on what happens in the state. But, while there still is risk in the state, we have to be incredibly cautious as a practice, and our patients need to be incredibly cautious.
And I think that's a good way to kind of go back to Dr. Wilfong, who serves on the Texas Oncology COVID-19 task force, to talk about how the guidelines for reopening in terms of our community was formulated and the safety, because we know that as cancer patients, there are some of us that are riddled with anxiety, right? And so we're thinking, yeah, we need to see our doctor. Yes, we need to go in, we need to have these procedures, but are we really ready?
Right. It's a great question. Something we struggle with every day of how do we take care of the patients we need to care for versus keeping them safe and out of harm's way of COVID. It's a tricky balancing act. But we do need to care for patients. We have a responsibility to care for our patients and doing that safely. And Dr. Pat mentioned telemedicine, and most of you probably don't know this, but when she puts her mind to something, it happens. And through her leadership, we were able to very quickly ramp up telemedicine. And kudos to her and the people she worked with to get that done. It's been a fantastic approach to safely be able to talk to your physician from the comfort of your homes, that you minimize risk completely in that approach. But there are things that can't be done by telemedicine. You can't get infusions or imaging, or sometimes we do need to lay hands on people to assess them. So the things that we've done to keep patients safe, so we screen people the day before. So you should be getting a call from someone asking if you've had any symptoms or exposures, because we don't want people who potentially have COVID or have been exposed to COVID to come into our clinics and potentially expose others. There's screening done at the front door, similar questions and taking temperatures and things, so that we can make sure that we're isolating patients that potentially have risk and keep them away from everybody else. Everybody's wearing masks. Masks help prevent the spread of COVID. If you potentially are carrying it and you have a mask on, the chances of your respiratory secretions getting to me are markedly less if you have a mask on, because it keeps it in you. And so we are asking everyone to wear a mask in our clinics to prevent that spread. And then we have safety protocols and screening besides our safety and screening protocols, cleaning protocols and other things like that to keep people safe. We try to socially distance in our clinic and keep everyone 6 feet apart as much as possible. Sometimes it's challenging. Many of you have been to our clinics that are smaller, and so it is a little challenging to balance that, space to take care of patients versus social distancing, but we're trying to do that as much as possible. And so that's something that we talk about regularly, is how do we balance the safety of our patients versus the need to take care of them and see them in our clinics.
Right.
And we're still working on it, and so more to come.
Thank you. We had a question come in. What does someone with a compromised immune system need to be more aware of moving forward? How long should I be concerned? And so anyone.
So I think that if you have a compromised immune system, you always need to be vigilant. But that's particularly true when there's community prevalence of COVID-19. And again, we anticipate that that's likely through July, maybe August, as we continue to get updates. And I think there are a couple things that make a big difference for individuals that are immunocompromised, like our cancer patients. I think socially isolating is critically important, socially distancing. So doing telemedicine visits, if that's what's appropriate for you, I think trying to make sure that you decrease your contacts, certainly making sure you don't have sick contacts. Masking, if you do go out, helps to do a couple things. It reduces other people's risk of you. It also stops you from touching your face so much, because you need to be compulsive about where your hands are and washing your hands. I literally walk around I wash my hands like 100 times a day, and I walk around with hand sanitizer. So if I go see a patient in the office, I wash my hands before I see them. I examine the patient. I wash my hands again. I touch the door to come out. I come in and I hand sanitize before I sit down at my desk. You have to be compulsive about hand cleanliness, because that's the predominant mechanism by which the virus spreads, is when we touch something and then we touch our mouth or our eyes, and it provides a conduit for the virus to come in. And so that's not changed. And immunocompromised patients should always be vigilant, but particularly so during coronavirus. And the reason why it's so important during coronavirus is because we know that cancer patients have a 3-fold increase in mortality. And so we have taken extreme measures actually in clinic to reduce the risk for our most vulnerable patients, to try to make sure that patients that are on treatment for active cancer continue to get treated safely.
And that's wonderful. And I think you just answered Teresa's question in the chat where she asked, are all cancer survivors considered to be immune compromised? We also have another question from Krista in the chat, and it says, at what point in cancer treatment does the risk level drop for a patient? Does anyone who's had a cancer diagnosis have to be incredibly cautious until community prevalence is near zero? Or, like someone like me who's 19 years out, would I still follow what the rules for a cancer patient? What should we do?
So I'll just give a follow-up to that, that all patients who have cancer are not immunocompromised. In fact, we follow a lot of patients in our clinic that are cancer survivors that have completely normal immune systems. And so it's a question you should talk about with your doctor. If you're on active treatment, does it render you immunocompromised? That's something important to know. And all cancer patients are not at high risk. Patients who, for example, had early stage breast cancer and underwent treatment, and we believe most likely are cured of their disease, those patients are more like a normal non-cancer affected person than they are a person who has active cancer throughout their body. So no, not all patients are at risk. The challenge, though, is that all patients that come to our clinics need to be cautious because they're exposed to our staff and the other patients that we serve. And so we really need anyone who's coming into our office to be judicious about making sure that they're safe and making sure that they don't put patients and staff in our office at risk.
Good points, wonderful points. Dr. Pat just really touched on the importance of social distancing. And so I want to come to you, Stephanie, and really discuss the importance of community, right? There are a lot of times where we can't get together in person, where we're missing that instant connectivity. So how do we keep a sense of community while we're going through this?
That's a really great question. I think, as you said, community is so important. I think there are a lot of resources and tools that can be used. And I think part of the challenges that came with COVID-19 are the social distancing. Because a lot of the things that we've used for community engagement before require us to come together in settings together. And even in the infusion room, normally our infusion rooms are people chatting, we're close together, you develop these bonds and relationships, but now even those are distanced a little bit, right? Our chairs are separated further. We're seeing patients at different frequency to keep distancing in place. And so how do you foster that sense of community when you're working towards social distancing as well? And so some of the things that I like to encourage people to do, there's apps like Caring Bridge, where a patient can engage that app, journal and update people on their status, and then they can respond to them, only the people that they want to engage, but they have this network of support. So the people that are concerned about them can tap in. Also, they can engage people to support them in different ways outside of coming to my home or outside of coming to visit me in my appointments. Maybe there are some things that you do need assistance with because you are social distancing. So pulling your community and support system together in ways to support you that don't put you at risk. So maybe that means someone else going out and doing your grocery shopping, but they don't know you have that need if you don't make it known sometimes. And so it's really encouraging people. Say it again for me.
Communication is key, saying what you need.
Yeah, saying what you need. And sometimes your community is trying to be sensitive to your needs. So really wrangling that support, but then also using organizations like American Cancer Society has great community support networks that are established. And we have some that as well, virtual support groups. Tapping into the resources that are available to really foster community if you don't have one of your own is really important.
Wonderful. And so we had another question come in, and it was, what does someone with a compromised immune system need to be more aware of, and how long should they be concerned? You kind of touched on it a little bit already, but where we know that, we're looking at into summer. Is it too much for someone to focus on a timeline, or should they try to be fluid and focus on the now, Stephanie? What part should they do? And I'll come right to you also, Dr. Pat.
So I really believe that it's really important to be present in our current circumstances. And I know sometimes for cancer patients, one of the things we do talk about is looking forward and trying to plan and those kind of things, which are really important. We talk about goals and values and exploring all of those things because planning is a critical part of what we do. But also one of the things when we're in the middle of a pandemic, it's important to understand that we are all in a little bit of a crisis mode. And so it's important to kind of just sit where we are and take it one day at a time. Take on what comes with today's challenges, today's victories, and then prepare for tomorrow. Because I think if we get too far ahead where we're planning about the what ifs, some of those things we can't plan for because there's just so much unknown. And then we send ourselves into a space of anxiety about the uncertainty and planning for uncertainty when we really can't. So it's really important to just take it one day at a time, take things as they come, even with planning for social events and family gatherings. Maybe that means that you do consider what does that look like for you to do things differently and creating this new normal, which the term kind of bothers me a little bit, but creating a new normal for yourself and how you guys plan your family rituals. So maybe that means rather than have your family reunion all together, 130 of you guys at the park, maybe you guys have a Zoom meeting and you do it in groups. I don't know what that answer is, but looking at opportunities to do things in a new way.
That's so great. And Dr. Pat, you wanted to say something?
Stephanie was perfect.
Okay, wonderful. And so I see the questions in the chat, and thank you guys for, I see the sense of community there. Yes, the journaling website is Caring Bridge. We talked about the Calm app. Ina Smith says, from a previous question, what has Stephanie experienced as a social worker, and what have been her challenges working remotely, besides the two little boys?
So I'll start with, as a social worker, for me, I provide oversight and direction for our social workers within the network. And so that's the entire state of Texas. And so specifically for me, one of the challenges that I think we have as an organization for our social workers is that we want to continue to meet the needs of our patients. Addressing the psychosocial and emotional needs of our patients is so important to us. And sometimes that requires having an in-depth conversation and meeting patients where they are, or if they've had a tough infusion, maybe something happened in their doctor's appointment and they've gotten some different news and we want to process that. And so with using technology, we've been trying to meet patients where they are when they're at home. And so having to adapt and be creative about how we really engage our patients who need us, because cancer care doesn't stop and the emotional toll of living with cancer doesn't stop just because we're in a pandemic. And so the challenge for us has really been, how do we creatively meet those needs of our patients? So like Dr. Pat mentioned, we're using, telehealth, doing a little more phone calls than we would normal, using virtual support groups to engage, which actually start, new step groups start on June 2nd, which we can talk about that later, but I just want to plug it since we're here. But really being creative about how do we meet the needs of our patients who sometimes we can't see face to face. Our offices are small, in the clinics. So our distance doesn't sometimes even meet the 6 feet parameters. So how do we engage them and still get to the heart of the conversations that we love and enjoy and being a part of to assist our patients? And so that's the biggest challenge, being creative. But also working remotely for our social workers, one of the things that I've had to preach over and over, not just to them, but to myself as well, is grace. Because they're used to working at a particular flow. And so when they're home, nobody's home completely, but they're home a few days a week and then in the clinic a few days a week to kind of help the clinic manage the flow of the number of people that are in the clinics. And so with that, when they're home, one of the things we talked about is adjusting their schedule so that it could be, this is the time that I'm going to be available to talk to my patients on the phone. This is the time that I'm going to do this, but also extending themselves grace that it doesn't look like what it looks like in the clinic. Because if they get too tied to what that looks like, then they can't function at home because they're trying to follow their clinic flow. And so we just have been really creative, and just our leadership has offered so much support with our team trying to figure out and find that balance as well. So I hope I answered the question.
Wonderful. Yep, absolutely. Dr. Wilfong, for anyone who may have put off an appointment, a treatment schedule, elective surgery, when will it be time to get back on track with a care plan? And I know that's hard because it's definitely something they need to talk to their doctor with, but this is a question that we had for you.
That's exactly what I was going to say. It's so individualized, depending on where you are with your cancer care, what that looks like. I mean, there are some things that can't wait that need to happen quickly, and there are things that can wait. And so that's where that discussion with your physician is so important, to map out exactly what that means for you, and how long can you safely wait to get whatever testing you need to get done versus needing to get things done now. And so that's really important to do. And I would say if you're concerned about coming into the clinic, that's where the telehealth visits make the most sense. So you can have that visit and that discussion with your physician while keeping you safe and make decisions together about what's right for you.
Thank you. Another question for Stephanie. I have strictly self-isolated over the last several weeks or months. How do I know when it's considered safe to be around my family and friends again? And I think that's the question we all want to know. We want to know when we can get our treatment, right? But when can we go and just be with our people?
So part of that, I believe, is a question and the answer that Dr. Wolfgang and Dr. Pat kind of can provide some insight to about safety and timing. But I think what's also important is that the people who are important to you, that they are also practicing safely as well when they're not around you. So for example, if they're going out to the beach, then you meeting with them is just as much risk, even if they're not, because of what they've exposed themselves to. So if there are people that are important to you that you have in your support system that you want to connect to, it's important to communicate to them the importance of their safety because of what it means for you. So for example, if you want to see grandma and grandma hasn't gone anywhere, and grandma's been home, social distancing, washing her hands and practicing appropriate care, then you see grandma. You guys mask up and you practice social distancing as much as you can within the context of that relationship. But I think some of those things are about what are the people around you who you are going to engage with, what are they doing? How do you make sure that they're practicing safety? Because everything that they've come into contact with now will come into contact with you.
Absolutely. Thank you. Dr. Pat, can you discuss those safety measures and precautions?
Sure. So I think that for the next several months at least, and to be determined, as Dr. Wolfgang and Stephanie have mentioned, there's uncertainty. But while we perceive there's a challenge, people need to socially distance. They need to try, especially if they're immunocompromised, to stay at home. I think it's hard, especially for people with kids and young grandkids, to not see them, to live in the same city and not be interacting with them. But, generally speaking, and it's an individual decision, which people can discuss with their doctor. But I've not recommended my patients on active treatment even see their grandchildren in person when their grandchildren are, for example, at preschool and they're on active treatment. I don't think that that's safe, and I don't think it's going to be safe for the next 2 months. So those are great discussions for people to have with their doctors, but definitely social distancing, making sure that whenever they are at home, that anyone that touches their home, that's done safely. So when people deliver things to their house, if someone has to come in and repair something, that you distance from that individual, that you have very clear hand washing, hand cleaning, for people to wear a mask when they go out. That's really important. Again, and that others that are interacting with you wear a mask when they come close to you. Those are important factors. And then as we all kind of have cabin fever, because I know, there's 5 people and 3 dogs in my house, we all get cabin fever, and we look to when we're going to go out and venture out and do something different, that we try to do that as safely as possible. And recognizing that we can't reduce every risk. How can we make sure we most reasonably reduce our risk? For example, if I decide that going to church is a priority for me, when churches are open, is that going to pose an increased risk to me? Because that is probably something that will pose increased risk. If I want to interact in that way, is there a way I can do it with less risk, like a Zoom opportunity? So, where you're going to go, who you're going to interact with, what you're going to see and do, all of those things will factor into how that contributes to your risk. And I think just trying to be as thoughtful as we can about reducing the risk that we are exposed to is important. And it's a lot more work. I mean, I think that what you're getting from this conversation is every step that we take takes a lot of forethought. Even as we talk about the management of patients, and as Dr. Wolfgang said, that's individualized per doctor. I'll tell you, every patient that we have is undergoing multidisciplinary treatment planning to try to make sure that we're taking the right and cautious steps that we can to make sure that cancer gets treated appropriately. So just have a lot of thoughtfulness as you re-engage with the world and think about each step of things that could contribute to your risk. Did you want to add?
I would say, oh yeah, I was just going to say, I think being honest and open with people is so important. My father is elderly and has cardiac conditions and things like that. He's very, very high risk for complications. And I've had to have some honest discussions with him that, Dad, I cannot come see you right now because as a healthcare worker, I worry about my risk to you. So we are going to have, Zoom calls, although that is very challenging with my father to do that. But my other brother, who is works in IT, who naturally just social distances because that's his lifestyle and career, he is taking the burden of helping my father and caring for them during this time. And so we've had an open, honest discussion as a family what that looks like and what that means for us.
Oh, great. Thank you so much. And Stephanie?
Yeah, and I just wanted to circle back to say, too, is, with all of these things in mind, there are a lot of different avenues that are popping up for ways to engage. There are, like Dr. Wolfong said, Zoom, but there are also different apps that are like family engagement apps. There are family game night apps where you're allowed to connect and play a game with your family virtually, and people can log in and it gives them the tools to do that. And so really be creative in thinking about how do I connect with my support system and the people that I really want to see or the places that I want to be in a different way. Just this past weekend, we got an invitation to a virtual paint night where you buy your own supplies or they mail the supplies to you. And then you guys all get together and on a Zoom, you paint the activity like you would go to Painting with a Twist. And so just kind of pursuing those creative things rather than sitting and just completely detaching from the world, figure out what are the tools that we could use to really engage and to meet the needs that we have.
Thank you. And I'm going to try to get through the rest of these questions. We're just a little over the halfway mark, but it's so much great stuff for us to discuss. And I also see the questions that are also on the Zoom chat as well. So here's a question. Because of my diagnosis, am I more susceptible to many viruses, including the coronavirus? Knowing this gives me a great sense of fear and anxiety about re-entering the community. What should I do to help my mental health? So I think it's a part Stephanie question where, Stephanie, you could give some steps to balancing the mental health side. And it's a strange situation for everyone around. And maybe one of our physicians can talk about the other part of it, the anxiety and the fear, and but knowing that you do have to protect yourself.
So I'll start, and then so with the challenges that come, the anxiety and fear, just living with cancer brings its own set of anxiety and fear with us just in general. But with the pandemic, everything's heightened. And so one of the things I encourage people to do is to journal. And I know people think it's lame, but I believe so much in journaling to help process how we feel and where we are. Because a lot of times we don't verbalize those fears, we don't verbalize the anxiety, so we're all bound up. We're all tied up and have all these emotions inside of us that we haven't adequately conveyed. And so journaling allows us to empty them. And then once we do that, then we can look at them and figure out ways to help manage those different feelings. For example, if you're having anxiety about the uncertainty of your treatment, then once it's on paper, you can identify that and say, okay, now this is something I can do. I can go to my physician and we can talk about that and we can plan and they can provide clarification and help me better understand. But also if we're just in general, meditation is so powerful. I firmly believe in the power of being able to quiet your mind and just really allow your body an opportunity to relax. Mindfulness is also a great practice. And a lot of times people think that you have to sit down and just be completely perfect at meditation. It is a practice. So the first time you start, your mind will wander, but it's really something that you try and you do over and over again until you're better at it. Using like apps like Calm, but also speaking to your support system, engaging in support groups. We have our virtual support groups for patients that are in treatment, which create a sense of community, provide emotional support, but then also some education too. We talk about skills, real coping skills that you can put into practice. So like journaling, like meditation, like mindfulness. We also talk about using sensory skills, but also like the changes with our bodies. How do we process and understand those things? but then also being aware of your own triggers. If there's a particular area that you struggle with in general, making sure that you reach out to either our sites or our staff for assistance to a mental health professional. We have licensed clinical social workers in many of our sites that can provide some assistance, but also we can get you connected to a therapist or a counselor who can help you process the feelings and emotions and anxiety that come with the season. Because it's really important to have that support that is intentional to talk about those things in a safe.
So wonderful. And I hate to jump back in, but we've got a little bit more that we want to jump through. One of the things that I also want to throw out, there's a lot of great resources out there. People are offering free classes, and they're good to not only busy your mind, but maybe take the time to learn, like Stephanie said, a new skill. So we have another question that is here, and I know it's one that I saw on the chat from someone. Let me just scroll back up from Jack. Jack asked, would any vaccination affect cancer treatment? We also had an email come in, Dr. Wilfong, when a vaccine is eventually made available, will it be safe for cancer patients to receive it? So we're going to put those two questions together.
That's a great question, and I don't have the answer yet. Most vaccines are safe for cancer patients to take. Sometimes there are live vaccines where they use a partially inactivated virus to cause the immune response for you. Many times those are not safe for our cancer patients to take because their immune systems are compromised. Versus most of our vaccines that we use normally are dead vaccines, so they use part of a viral particle to help you have immunity to that. Way too early to know because we're still in very early development of those vaccines. So that is something that we definitely will talk about and make statements about when those vaccines become available and we have more insight into the safety of those for our cancer patients.
Thank you. And so I also want to get in, we have Karen. My husband was released to work from home until his immune system recovers. And I'm sorry, you guys, I should have put my glasses on before I started this. He is about to start his final phase of pancreatic cancer treatment, 6 weeks of chemoradiation. What is the best way to determine when his immune system is strong enough to return to his office? We also have a question, is it safe to go get blood work done for a patient who is in remission? When can I bring my family members to treatment again? So I'm just kind of lumping those questions. I apologize, but I want to get them all in for time, Dr. Pat.
Yeah, no, it's a great question. Those are all great questions. And I'll say that they're very individualized. And so I would recommend that they call the office and get guidance from one of our nurse navigators or their physician to help make that determination. I'll say that generally speaking, when patients undergo active treatment, their immune system recovers after that. And so they should be able to give them a timeline, but it may be different for different patients because, you know, we'll monitor your labs, make assessments about whether your immune function is normal or not, and then make recommendations with regards to you returning to work. And those are always great conversations to have with your physician because they could be partnered with the supporting documentation. For example, if your physician thinks it's not safe for you to return back to work, at that time, they can write for you a letter to support you staying home. Or if you have to engage in FMLA or something like that, they can help with that, disability paperwork, that kind of information. So our social workers is a resource. So those are great conversations to have with your physician. And there's not a particular piece of guidance because it can vary quite a bit between individuals.
And Dr. Pat, while we have you here, Dr. Wilfong, you wanted to say something?
Oh, I was just going to add, 99% of the time when you show up in the doctor's office, you forget those questions, write them down. Write them down so that you have your list for the doctor so that you won't forget to ask.
Thank you. Yes, very important. Dr. Pat, does cancer, even after treatment, make you higher risk for COVID-19 complications? How long after finishing treatment am I immunocompromised?
So I'll say, generally speaking, when patients finish treatment, if we believe that they don't have any disease left, then they're more like a normal patient without cancer than they are a patient with cancer. And generally, people's immune system bounces back, within weeks of a treatment. But there is variability between patients, and so great conversations with your doctor. For patients that have active cancer and they're on active treatment, for many patients that are on active treatment, cancer is like a chronic disease, like hypertension or diabetes, but they continue on active therapy that might render them immunocompromised. So even though they may only be taking 2 pills a day and they have generally no side effects that they feel, they might continually be immunocompromised. And for those patients, the risk of getting COVID is conveyed with a higher mortality. So they need to be particularly careful.
Thank you. Stephanie, kids may feel extra stressed about exposing a parent with cancer to COVID-19. How can they feel safe with things opening back up?
That's a really great question. I think one thing I always encourage families to consider, and especially patients to think about, is that our kids are little humans. And sometimes they're very resilient. And so they can handle a lot of information if we have the conversations with them. And so one of the things I first would do is have a very open and honest conversation with them, saying, validating their feelings. Because for many of us, we have the same feelings as well. So validate their feelings and make sure that if there's any feeling that you have about them going out as well, that you share those as well. But also one way to address those is engage them in working to find a solution. So for example, if they are, the plan is that they're going to go back to camp, maybe, let's just hypothetically, okay? One of the things to say, well, what are some things that you think that we can do as a family to make sure that you're safe and also we minimize exposure so we keep mommy safe? Engage them in that process. And if you guys don't know, then maybe do a little bit of research and engage in different areas, because maybe camp isn't a good solution right now. Maybe it's not the best option for your family if it's a concern, especially with the exposure, what the safe social distancing would look like in that area. So really engaging those children in the conversation provides a lot of release of the anxiety to help engage them. But also, if there is, one of the things that I do, especially with when it comes to palliative care, is engaging the family in their level of support, making sure that they're aware that what they do and their concerns help to keep us all safe and are a part of what caring for us as well. And so making sure that they feel like they're an integral part and that their concerns are valid, and that you validate anything that they want to bring to the table to help keep you safe. I think it's important too, so that they feel like they're part of the solution, not just a problem because of the exposure that they may have.
Thank you. Dr. Wilfong, I'm interested in this question, and even if there is an answer to this question, but how does one stay safe long term? We can't stay indoors forever, so what do we do? How do we prepare?
Thank you for that very fun and challenging question. I think we don't know. We don't know exactly what's going to happen, which makes it scary. People ask all the time, well, what is it going to look like in August and October and next year? And I don't know. There's so many variables that play into that. Are we going to have a second wave, as people have heard about in the fall, where we have more risk and spread of the disease? Is it going to die down over the summer or not? We don't know. And so I think I think Stephanie said it great earlier, keeping it fluid, taking each day as it comes, thinking about today and being open to whatever happens in the future is important. Hopefully, if we get a vaccine and we get the control of the pandemic and the community spread starts to lessen, we can open back up safely, and we will all feel much more comfortable going out in the future. I think in general, though, because of just, I think Dr. Pat said this earlier very well, we just need to be careful, especially if you are getting therapy and are immunocompromised. Just be careful. Think about where you're going. Hand sanitation is really important. Sanitizing is really important. And just being careful and being mindful of all of those things will, as long as you're a patient undergoing therapy, is important.
Thank you so much. And Stephanie, there was a question in the chat that you'd like to address.
Yeah, when I mentioned Caring Bridge, Jay mentioned that they have been using it and they really enjoy the app, but the problem is the nonstop sympathy. and well wishes that come because that engagement isn't helpful to their loved one who's using the app. And so we hear that a lot. What happens is I believe that it's really important for us, if you're the patient, to set the tone of communication. So when you put your description of what you're going to do and what you're carrying bridge, and you add your information, set the tone. Say that, for you, it's really important that this is your state of mind and where you are with the process, and you are hopeful and working diligently towards a resolution or to a cure or whatever your desire is to say there, and say, this is what I would like from you. So I appreciate your well wishes, but we're not sad, we're fighting. If that's where you are. If whatever place you are within your disease process, or be really clear about conveying that. Set the tone for yourself. And I think that helps others know how to adapt and how to respond so that they know where you are. I hope I answered that.
Thank you so much. And if I missed any other questions, I'm just scrolling through really quickly. Please just ask them again, or just post like there's a question and I'll scroll up. But I think that we covered them all. I know I just want to take a moment to really just thank all of you who are on the front lines, and who not only just take care of us every single day, but to continue taking care of us and being there for us. We're stronger together. And part of that strength is definitely the strength of our community, and we could not do it. So thank you so much, Dr. Wilfong, Dr. Pat, Stephanie Broussard. We couldn't be where we are without you, and we know that we'll need an extra hand holding as we continue to navigate through this process. And so I think for me, what Julie just asked, could co-fund research take away from cancer research funding? Dr. Wilfong?
It is possible.
Dr. Pat.
It is possible that COVID research could take away from cancer funding. Yeah, there's a lot of collateral damage actually because of coronavirus that we haven't talked about. So I'll just touch on it briefly because it does touch many of us with cancer. I'm grateful that the Texas Oncology Foundation is doing this webinar and educating patients, but many philanthropic organizations that support cancer are forecasting substantially decreased revenue projections. And as a natural consequence of that, we've seen them make adjustments throughout the country. So we've seen changes in support organizations like the American Cancer Society, like Komen, like the American Diabetes Association, that have all had layoffs and consolidation as to how they think about their mission and how they can best satisfy their mission. So that's a challenge, and I imagine that that will grow, with unemployment on the rise and people feeling a pinch in their pockets because if they have not been laid off, maybe their salary has been reduced. Philanthropic funding goes down, and so there's a lot of collateral damage there. It's a real challenge. Some of that will be research funding as well, because there's only so much to go around. So that's a challenge that we'll have moving forward. And I'll say that while we have these challenges, and that all sounds very ominous, I will tell you, I've never been more proud to be part of our organization in Texas Oncology, that Dr. Paulson, Dr. Wilfong, colleagues like Stephanie, Tamika, survivors like you have made us really, I think, excel at figuring out how to innovate and support our patient population differently. It has been challenging, but we have really risen to the challenge because of our individual efforts together to make Texas Oncology navigate this climate well. And I think it's really served our patients well.
I think that's a wonderful thought just to kind of just end this on, unless Stephanie, Dr. Wilfong, do you have anything else that you want to say?
That was perfect.
Yeah.
Great.
It was great. So thank you, Stephanie Broussard. Thank you, Dr. Wilfong. Thank you, Dr. Pat. Thank you, Texas Oncology. Thank you, Texas Oncology Foundation. I'm sure we're going to be seeing you again for another wonderful webinar. I just think this is wonderful, and an extra shout out to every single one of you who joined us. We're still over 100 participants. I think that's amazing. That again shows the strength of our community. This will be available for replay. Be sure to check it out. Be sure to go to the Texas Oncology Foundation and check out all the wonderful resources there. And I will see you again at some point in the future in person, but until then, I'll be joining you virtually. So for everyone here at Texas Oncology Foundation, thank you. Enjoy your day, stay safe, and keep in touch. Bye-bye.
Bye.
Okay, great job, Tamika.
You're so awesome, Tamika.
You did a great
Thank
job.
you.
I think we're still live.
Thank you.